we should be preventively vaccinating healthcare workers and other frontline workers. So those could be ambulance drivers or traditional healers or burial workers in countries that may experience an Ebola outbreak.
Welcome to Global Dispatches, a podcast for the foreign policy and global development communities and anyone who wants a deeper understanding of what is driving events in the world today. I'm your host, Mark Leon Goldberg. I am a veteran international affairs journalist and the editor of UN Dispatch. Enjoy the show. Listeners will no doubt remember the devastating Ebola outbreak of 2014 to 2016. More than 28,600 people had been infected, and over 11,000 people had died across several countries in West Africa. One of the hardest hit places was Sierra Leone, where nearly 4,000 people lost their lives. In the years since, scientists and civil society advocates have raced to develop and implement a vaccine to protect against future Ebola outbreaks. That vaccine works, and works well. It was tested in outbreaks in the Democratic Republic of Congo, and now it is being deployed proactively to protect those at-risk populations, including frontline health workers. This includes Sierra Leone, where the vaccine is being deployed for 20,000 frontline workers so they can protect their community and the world from the next outbreak. My guest today, Allyson Russell, is at the forefront of these efforts. She is the Senior Program Manager for Outbreaks and Global Health Security and Vaccine Programs at GAVI, the Global Alliance for Vaccines and Immunizations. We kick off discussing the toll the 2014 outbreak inflicted on the region before having a longer conversation about how this new Ebola vaccine will work and prevent the next outbreak before it spreads. Today's episode is a good example of one of my favorite kinds of things that I do with this show with frequency, which is solutions journalism. That is, how do we solve some of the great global problems that exist in the world? Most journalists, I dare say, focus on the problem as a problem. And that's appropriate in some circumstances, to be sure. But I like to flip the script a little bit and not only dwell on the problem, but explain how we get from a problem or a challenge to a solution. And in this episode, you'll learn how we went from having a really absolutely devastating Ebola outbreak 10 years ago that seized the world's attention and really threatened global health security across several countries and several continents, to a situation today in which an Ebola outbreak is no longer a great global threat thanks to this new vaccine. Now, here is my conversation with Allyson Russell of the Global Alliance for Vaccines and Immunizations, GAVI. So, Allyson, before we discuss the rollout of this new Ebola vaccine in Sierra Leone, could you just take us back to 2013 and the West Africa Ebola outbreak that kind of seized the world's attention at the time? What happened in Sierra Leone?
This was an outbreak that really caught the world's attention and was completely unprecedented in size and in scope and in the devastation that it caused. So we know that this outbreak started in Guinea and quickly spread to the neighboring countries, mostly Sierra Leone and Liberia, and of course spread to a few other countries as well, but these were really the hardest hit countries. And over the course of the couple years of this Ebola epidemic in Sierra Leone, among the 14,000 that were infected, about 80% passed away. There was not a vaccine available in the world at this time, and that represented about 7% of the healthcare workers in Sierra Leone actually succumbed to Ebola. They were really at the front line of fighting this epidemic, and they suffered the toll of that in their duties.
Yeah, I mean, I remember at the time just the devastating toll that this Ebola outbreak took on healthcare workers themselves, who were, I said, were on the front line and were dying trying to treat patients in just massive numbers, and it was a real blow to the healthcare systems of these countries as well.
Absolutely. I was in between Ghana and Liberia at the time, and I worked in Liberia for a few years after that. And, the healthcare workers that I worked very closely with, they had no choice. This was their country, their families, their communities, and they took up that call of duty to respond to this epidemic. But we didn't always have the tools. We didn't have any vaccines, and trying to provide care for those who were sick and not get infected yourself was very challenging to do in this environment.
So, in the wake of the massive 2013 West Africa Ebola outbreak, there was renewed efforts to accelerate progress on an Ebola vaccine. What can you tell me about the development of that vaccine and how it came to life?
So, Ebola has been around for some time. The first outbreaks that we know of were in 1976. But these outbreaks over the past decades were often small in remote areas and essentially exterminated themselves before spreading. As you said, this outbreak showed that we needed a vaccine. We needed to be able to preventively and during an outbreak protect healthcare workers and the population, any of those who could be infected. So, when this outbreak happened in 2014, 2016, GAVI made a commitment to purchase and support any available and acceptable vaccine against Ebola. And this was really a signal for the market to say, this is a vaccine that we need to invest in. This is a risk to global health security. It's a risk to our health workers, to all of our responders, and we need to have a vaccine. So, following this signal of this commitment, Gavi made an advance purchase commitment to Merck, which was the first company to produce an Ebola vaccine, for about 300,000 doses. And these were able to be used in the years following. Unfortunately, it took a few years to develop this vaccine, but in the years following, and they were used in some of the outbreaks that happened in DRC in 2018 to 2020.
Yeah, no, I remember that when that happened, you had these outbreaks in the DRC that were limited in scope, and partly they were limited because of the introduction of the vaccine at the time. And correct me if I'm wrong, but the strategy employed was to use these vaccines in a very deliberate way called ring vaccination.
Yes, so ring vaccination is how SAGE has recommended. SAGE is the advisory group to WHO, and they make recommendations on how we should be using the vaccines we have. So SAGE has recommended that this vaccine be used in ring vaccination approach, and that was actually how the clinical trials for this vaccine were also done. So we know that it's an effective way to implement Ebola vaccination. Essentially, once a case is identified, they will list everyone that they might be in contact with. This could be people in their house, people they work with, people they were in the bus with recently, etc. And it could be prospectively people they could contact or those that they had contacted in the past. And all of those people in this ring, so it might be 90 or over 100 people per case, will be vaccinated. This will hopefully prevent the transmission to those people. But what we've learned since this outbreak in DRC is that it actually reduces the severity of Ebola, even if you've already been exposed to the disease, and it reduces the likelihood of you passing away from Ebola, even if you're vaccinated after the time that you were exposed.
Oh, wow. So you could get vaccinated after exposure and your risk of dying from this otherwise extremely deadly virus is reduced.
If it's within a couple of days,
Hmm.
yes, that is what we are seeing.
So not only did this ring vaccination strategy work in helping to contain these outbreaks, but it served as a clinical trial.
So, the clinical trial for the vaccine was actually conducted in 2015 in Guinea during this first outbreak.
Hmm.
But additional data was needed before it could be pre qualified, before it could be licensed. And how we use the vaccine also depends on what we know about the duration of immunity. So, how long is the protection going to last? How often do you need a vaccine? So, some of those additional data were generated over the years that helped to develop the strategy for how we now use the vaccine, which is reactively in outbreaks using the same approach, this ring vaccination approach that we saw help to control the outbreaks in DRC. And preventively. We now have a recommendation that says that we should be preventively vaccinating healthcare workers and other frontline workers. So those could be ambulance drivers or traditional healers or burial workers in countries that may experience an Ebola outbreak.
And that new recommendation to preventively vaccinate high-risk groups is something that was included in the rollout of this new vaccine in Sierra Leone. Can you kind of walk me through what this new rollout will look like?
We have been actually using the Ebola vaccine preventively for a number of years because we know it works very well. It's a very efficacious, very safe vaccine. But exactly what the best strategy was and how broadly we should be vaccinating, this is what we needed the global guidance on. So the SAGE group provided this guidance in May, and GAVI opened the funding for preventive vaccination in June. So now any at-risk country can do preventive vaccination of these high-risk populations. So what does this look like for Sierra Leone? Sierra Leone's not the first, but this is really monumental for the country. It's the first country in West Africa. DRC has been doing some preventive vaccination. But in Sierra Leone, this is really critical for a country that was affected so dramatically by this outbreak in 2014 to 2016. It's a country that remains at risk for Ebola, both from the risk of a zoonotic spillover, for instance, how the Ebola outbreak started in 2014, but also from persistence of the virus among survivors. And that's how there was an outbreak in Guinea in 2021. So it's important that we're protecting the healthcare workers, and the country has taken a lot of initiative to move ahead with Ebola vaccination among their healthcare workers, their frontline workers, even amidst all the other priorities that they have going on in the country for their health system. So what they're going to do, they've committed to this week, this month, roll out preventive Ebola vaccination. This will be among who they've considered the at-risk population. So who's at risk in Sierra Leone? These are the healthcare professionals, the ambulance, motorbike riders, traditional healers, religious leaders. These are people that community members might go to when they first feel sick from some unknown illness. They're also targeting military personnel and security forces, anyone who would be called upon to respond to an outbreak if it were to occur.
So, like thousands of people, presumably.
Thousands, 20,000 is the number, actually.
I mean, so how does this kind of change the whole game around Ebola prevention? We had this massive outbreak in 2013, 9 years ago. You've had sporadic outbreaks, mostly in the DRC. Since then, I mean, can we now consider like Ebola no longer a great global health threat because of the advent and the deployment of this vaccine?
We do have a new tool, and this tool is really important because it is a highly efficacious, very safe vaccine, but it's not going to be possible to vaccinate everybody who's at risk. They're spread across a huge region of Central Africa from DRC all the way to West Africa, and we will never know exactly where one is going to pop up and who is at risk. What we can do is use this additional tool that we have to try to reduce the risk that when an outbreak pops up, that it spreads, that we can try to reduce the lethality of these outbreaks. What we were seeing before with these outbreaks was that 80% of people infected might pass away, up to 80%. So we're hoping to both protect the healthcare workers and prevent them from spreading to others, especially at the beginning of an outbreak when maybe the cause of the outbreak isn't yet known. We don't yet know it's Ebola. And we want to protect them and prevent the further spread. So we will still need to do all of the other measures. We'll need to have good surveillance. We'll need to have laboratories that can confirm the cause of disease. We'll need to make sure healthcare workers know how to prevent infection for themselves, but also among the healthcare setting. But certainly this is a huge advancement in the tools that we have for this very deadly disease.
Presumably, though, because of the advent and deployment of this vaccine, a massive outbreak like what we saw in 2013 across West Africa, that just won't happen again.
We really hope not. And that depends a lot on countries' ability to quickly notify that there is a disease of unknown origin, to determine that's Ebola, and to deploy the vaccines. DRC has done this extremely well in the past few years. There were a few outbreaks in 2021, 2022 vaccines were used within a few days, and we were able to, between vaccines and the other control measures, contain these outbreaks to a very small number of cases using only a couple thousand vaccines.
So one of GAVI's real kind of bread and butter operations is the purchase and deployment and partnering with poorer countries in the distribution of routine childhood vaccinations. How does the Ebola vaccine kind of fit into GAVI's broader strategies and plans for the future? Is there any prospect of the Ebola vaccine being included in like the routine vaccination schedule of many of these countries?
That's a good question. And you've really said it, that this was what GAVI was set up to do, was to make sure that lower income countries could access vaccines in the same way that children in high income countries could access vaccines. And we are doing this in Sierra Leone. We're supporting the country with their entire routine immunization program. We're helping to introduce new vaccines there, HPV, malaria, among those this year and next year. Ebola vaccine isn't necessarily a vaccine that we would see everybody needing. We also have to think about what is the priority for the finances that we have, which are finite resources in the world, but also for healthcare workers' time in doing these vaccinations. So at this point, we wouldn't see the Ebola vaccine being used in the general population, but we'll see in the coming years, perhaps there is a lower cost vaccine. Maybe we have additional data on how long the duration of protection of this vaccine. Right now, we have very good data that it lasts 5 years. We will see if it's extended beyond that, which we expect. But for a vaccine to be in the routine program, we need it to be cost effective. We also need to make sure that it's going to give a long protection and make sure that the people who receive it are protected when they would be exposed. So at this point, it makes most sense to use the Ebola vaccine just in these high-risk populations, but we'll see what the future holds.
So in terms of the Ebola vaccine, as you noted, it probably doesn't make sense at this point to include it in a routine vaccination schedule. So what's next for the deployment of this vaccine in high-risk countries?
So GAVI launched the Preventive Ebola program in June of this year. This was something we'd been looking forward to doing for a number of years. This was approved by our board even before COVID, but we were waiting on this new recommendation from SAGE, from the advisory group to WHO, on exactly how should we be using this vaccine preventively. So now that we have those recommendations, we were able to launch this program, and there are 18 countries that are considered eligible at-risk countries that are GAVI-supported countries. And we are hoping to work with these countries to roll out preventive vaccination among their healthcare workers over the next few years.
So if that's your goal, if that's your target, do you have the funding, the resources to meet those targets yet? Are you fundraising around this?
We are in a fundraising cycle at the moment. So we're currently fundraising for our next 5-year strategic period, which will be 2026 to 2030. And the routine vaccine, supporting countries' immunization systems is really the core of GAVI's business. But there's an increasing need to ensure that countries are prepared for the next pandemic, that we have vaccines that will protect populations for these more rare but more severe diseases. And this is something that we are hoping to be able to continue supporting in the years to come.
Well, Allyson, thank you so much for your time and for saving us all from Ebola.
It's been an incredible partnership over the past decade to get to this point between our alliance partners, WHO, between the industry, the manufacturers, and we're really excited to see countries be able to benefit from this and protect their health workforce.
Thanks for listening to Global Dispatches. The show is produced by me, Mark Leon Goldberg. It is edited and mixed by Levi Sharp. If you are listening on Apple Podcasts, make sure to follow the show and enable automatic downloads to get new episodes as soon as they're released. On Spotify, tap the bell icon to get a notification when we publish new episodes. And of course, please visit globaldispatches.org to get on our free mailing list, get in touch with me, and access our full archive. Thank you.